Most people miss number 3, and that's exactly why this matters. If you're over 60 or caring for a parent or partner who is, don't let these 8 early warning signs slip by as just aging. They can point to changes in the brain's blood supply that doctors can investigate. This video is for education only. Only a medical professional can diagnose vascular dementia or any other condition. What follows is intended to help you notice patterns, document them, and take informed steps to get medical evaluation. Vascular dementia, a short, practical picture. It's not a single disease like Alzheimer's. It's a group of cognitive problems linked to reduced blood flow in the brain, often from small strokes or chronic damage to blood vessels. That creates a different pattern than Alzheimer's. Instead of a slow, steady downhill, vascular problems often show a stepwise or sudden change. Someone seems fine, then after a small stroke or series of events, they lose a chunk of function, then stabilize, and maybe decline again later. That difference, suddenness and stepwise loss, is important when you're watching someone you love. If you're watching for a loved one, save this video so you can reference the documentation checklist at the end. Now let's walk through the 8 early signs, from 8 down to 1, with short examples, what might be happening in the brain, and what to watch for and write down. Sign number 8, trouble planning or organizing, executive dysfunction. Definition: this is when everyday tasks that require planning or juggling steps become difficult, not because someone forgets facts, but because they can't sequence actions or make a plan. A tiny scene. Imagine your mother used to prepare a simple meal effortlessly. Lately, she starts making spaghetti sauce while frying breaded chicken, forgets the timer, and several dishes are ruined. Or she opens the mail but can't sort bills from junk. She might say, "I don't know where to start," when asked to do routine things. Why it matters, in plain language, executive functions live in the frontal lobes and their connections. When blood flow to those regions is interrupted, the brain struggles to coordinate steps and make decisions, even if memory for names and faces is still okay. What to document? Note when it started, a short description of the task, what part was confusing, timing, sequencing, decision-making, and whether it happened once or repeatedly. For example, April 12th, attempted to pay bills, couldn't follow sequence, asked the same question 3 times over 20 minutes. Research note: studies have shown that problems with planning can appear early in vascular cognitive impairment because small vessel disease often affects frontal subcortical circuits. Sign number 7, increased confusion and disorientation at night, sundowning. Definition: a pattern of worsening confusion, agitation or disorientation in the late afternoon or evening. A tiny scene. Your father seems fine during the morning, but at dusk he becomes restless, calls out for people who aren't there, or wanders to the front door asking to go home, despite being at home. Lights and noise seem to make it worse. Why it matters, in plain language: the brain's internal clock and attention systems are sensitive to stress, fatigue, and disrupted sleep. In people with vascular damage, the networks that keep time and filter sensory input can fail as the day progresses, producing greater confusion at twilight. What to document? Log when the confusion happens. Time of day, how long it lasts, activities right before it began, whether sleep was poor that night, and any triggers like low lighting or loud noise. Example: May 3rd, 6 to 8 p.m., pacing and repeated questions after a noisy family dinner. Research note: sundowning is commonly reported in mixed and vascular-related cognitive conditions. Noting the pattern helps clinicians separate temporary delirium from an ongoing cognitive change. Sign number 6, trouble finding common words, word-finding difficulties. Definition: struggling to name objects or people that should be familiar. The tip-of-the-tongue moments become more frequent. A tiny scene. At brunch, your spouse pauses mid-sentence, looking for the word teapot, then substitutes that thing for tea. It happens more than once and becomes noticeable in conversation. Why it matters, in plain language. Naming relies on networks that connect language centers with other parts of the brain. Vascular injury can disrupt those connections, so the brain's route to a word gets interrupted even though the person recognizes the object. What to document? Write down the word that was missed, the date and time, whether the person could describe the object after searching, and whether the problem was limited to a certain type of word, names versus common objects. Example, May 15, couldn't name microwave, described as the box that heats food, resolved after 30 seconds. Research note, word-finding issues are often seen in both Alzheimer's and vascular cognitive changes, but sudden onset or stepwise increases suggest vascular contribution. Sign number 5, difficulty following conversations or TV plots, working memory, processing. Definition, trouble keeping up with what others are saying, losing track of the thread in a conversation, or getting confused by storylines on television. A tiny scene. You notice your aunt stops watching a movie halfway through because she can't follow who's who, or your neighbor switches off the TV and asks, what happened in that show? After only a few minutes. Why it matters, in plain language. Working memory, the brain's short-term holding system for incoming information, depends on adequate blood flow to networks across the brain. If those networks are disrupted, processing speed slows and holding on to multiple pieces of information becomes challenging. What to document? Record instances when they had trouble following a conversation, who was present, the topic, whether there was background noise, and whether the difficulty was temporary or persistent. Example, June 1st, could not follow family conversation during breakfast, asked the same question twice. Research note, slower processing and working memory problems are common early signs in vascular cognitive impairment and can appear even when long-term memory seems relatively preserved. Sign 4. Problems judging depth or spatial relationships, visual spatial deficits. Definition, difficulty judging distances, misjudging steps, bumping into furniture, or trouble with maps and spatial tasks. A tiny scene. Your neighbor, who has always gardened, suddenly waters the stepping stones in the yard, but misses a step and nearly falls. Or your partner refuses to drive at night because headlights blur into streaks. Why it matters? In plain language, visual spatial skills come from parts of the brain that interpret visual information and how things relate in space. When small strokes or vascular damage affect these regions, everyday tasks like pouring water or navigating a room become harder. What to document? Note specific examples. Times they bumped into furniture, misreached for objects, or had trouble judging stairs, including lighting conditions and whether vision was otherwise normal. Example, June 10th, misjudged curb height while walking, stumbled but did not fall. Morning, sunny. Research note, visual spatial changes are sometimes under-recognized and can be mistaken for poor eyesight. Documenting the pattern helps clinicians decide if a visual or neurological cause is more likely. Sign number 3. Subtle changes in walking or balance, gait changes, dual task difficulty. The most missed sign, definition, small changes in how someone walks, shorter steps, slower pace, shuffling, hesitancy, or a marked decline when doing two things at once. For example, walking while talking. A tiny scene. Your mother used to stroll confidently around the park. Lately her steps are shorter. She hesitates before turning, and she falls behind when the group walks and talks. At home, she sometimes stops mid-step if asked a question. Why it matters, in plain language. Walking is not just a leg action. It's controlled by brain areas that coordinate movement, attention, and planning. Tiny strokes or reduced blood flow to those regions can affect gait early, before memory problems are obvious. Because a change in walking can be subtle, family members often attribute it to arthritis or getting old and miss what it means for the brain. What to document? Describe gait changes in plain detail, step length, speed, hesitancy, need for support, episodes of imbalance or near falls, and whether the changes worsen when the person is talking or carrying something. Record when you first noticed it, and whether it seems to happen more after tiring, when distracted, or during certain times of the day. Example: June 18th. Shorter steps and hesitation when turning. Noticed while walking in grocery store. Worsened when carrying bags. Research note: multiple studies, including longitudinal work, indicate that subtle gait changes and difficulties performing a cognitive task while walking may predict vascular cognitive problems. That makes gait an important early clue, often the most overlooked. Sign number 2, sudden emotional changes or loss of emotional control, emotional lability, or pseudo-bulbar affect. Definition: unpredictable mood swings, sudden crying or laughing without an obvious trigger, or disproportionate anger and irritability compared with previous personality. A tiny scene. Your father, usually even-tempered, suddenly bursts into tears at a small frustration or laughs inappropriately during a serious conversation. Or he becomes unusually short-tempered in places that never bothered him before. Why it matters, in plain language: emotional regulation depends on networks connecting the frontal lobes and deeper brain structures. Vascular injury can disrupt those pathways and make emotional responses less controlled or appropriate, even when the person understands the situation cognitively. What to document? Record episodes of sudden crying or laughing, what happened before, how long the episode lasted, and whether the person was aware of or embarrassed by it afterward. Example: June 21st. Sudden crying for 5 minutes after minor frustration. Could not explain why she was sad. Research note: emotional lability is a recognized sign in vascular-related cognitive disorders. It's often distressing for families and can be mistaken for depression without careful evaluation. Sign number 1. New urinary urgency or frequency without infection, autonomic bladder signs. Definition: a noticeable increase in needing to urinate urgently or more frequently without a urinary tract infection explaining it. A tiny scene: your parent who used to sleep through the night now wakes several times to go to the bathroom, or they suddenly need to stop every 20 to 30 minutes on errands, even though their fluid intake hasn't changed. Why it matters, in plain language: bladder control involves pathways that run through deeper brain regions and the connections to the spinal cord. Vascular damage in these areas can produce urinary symptoms before clear memory problems. Because bladder changes are often attributed to age or a bladder infection, their significance for brain health can be missed. What to document? Log frequency and timing, whether nighttime awakenings increased, whether there was leakage, and whether a urine infection was tested and ruled out. Example: June 25th, started needing bathroom every 30 minutes. Urine test negative for infection. Research note: new urinary symptoms without infection are a recognized early sign in some vascular cognitive disorders and should prompt discussion with a clinician, especially when they appear alongside other cognitive or gait changes. Quick transitions and perspective. These 8 signs don't appear in isolation. Often the pattern that points toward vascular causes is sudden changes, stepwise losses, and a combination of motor, walking, autonomic, bladder, and cognitive, planning, processing problems. If you notice one sign, look for others. If you find several, that pattern becomes more important to share with a doctor. What to do next? A practical checklist for your visit. First, document the examples you have noticed. Clinicians rely on specifics more than impressions. For each concerning event, write the date, time of day, brief description of what happened, who was present, what the person said or did, how long it lasted, and whether it resolved or recurred. Add any medical events around that time: falls, hospital stays, infections, changes in medications, or new diagnoses like high blood pressure or diabetes. Second, when you make the appointment with the primary care clinician, describe the pattern and bring your notes. Ask for an appropriate evaluation that commonly includes brief cognitive screening tests, consideration of more detailed neuropsychological testing if needed, and brain imaging to look for strokes or vascular changes. Typical imaging used by clinicians includes MRI or CT scans to assess for small strokes or white matter changes, and vascular assessments such as blood pressure monitoring and tests that evaluate the heart and carotid arteries when indicated. These are commonly used tools to determine if vascular factors could be contributing to cognitive change. Third, discuss referral to a specialist if recommended. A neurologist, geriatrician, or memory clinic can offer targeted assessment. Therapists such as speech-language pathologists or physical therapists may be helpful for word-finding or gait issues, respectively. Ask whether balance testing or a physical therapy evaluation would be useful if gait changes are present. Fourth, keep a copy of any medication lists, recent lab results, and a brief medical history, including recent illnesses, falls, and hospitalizations. If possible, record brief videos on your phone of the behavior that concerns you. A short clip of the person walking or an example of word-finding difficulty can be very helpful for clinicians. Tests and evaluations to consider discussing with your clinician as appropriate. Mentioning specific evaluations is useful so you and your clinician can decide together what's appropriate. Common elements clinicians discuss include cognitive screening tests to assess thinking and memory, consideration of neuropsychological testing for a deeper look. Brain imaging, MRI, is often preferred to detect small vessel disease and prior small strokes. CT may also be used depending on access. And cardiovascular evaluations such as blood pressure checks, ECG, and assessment of heart rhythm or carotid circulation when indicated. Your healthcare team will personalize this based on the history and findings. Safety and practical tips. Handle with care. If you've noticed gait changes, near falls, or increased confusion at night, safety becomes a priority. Consider a professional falls risk assessment, home modifications to reduce tripping hazards, and ensuring good nighttime lighting. Driving is a nuanced issue. Rather than making sudden, unilateral decisions, discuss concerns with the clinician, who may recommend a driving evaluation, temporary alternatives, or increased monitoring depending on the findings. Occupational and physical therapists can recommend strategies that preserve independence while reducing risk. The guiding principle is evaluation and support, not abrupt removal of autonomy. Lifestyle and vascular health. What to discuss with a clinician. Because vascular health affects the brain, maintaining good control of vascular risk factors is an important conversation to have with the clinician. Key areas to review include blood pressure control, diabetes management, cholesterol, smoking cessation, healthy diet, physical activity, and weight control. These are not guarantees of prevention or reversal, but managing these risk factors can reduce additional vascular injury and is recommended as part of a comprehensive care plan. Any changes in medications, diet, or exercise should be discussed and coordinated with the person's healthcare team. How to talk with your loved one. Empathy matters. Bringing up cognitive symptoms can be scary and emotional for everyone involved. Approach the conversation with empathy. Focus on specific concerns and safety, not blame. Use I statements. I've noticed you seem to hesitate when walking rather than you're getting clumsy. Reassure them that you want a checkup to find causes that are treatable or manageable, and that many conditions, some reversible, can affect thinking and motion. When to seek urgent care. If the person has sudden new weakness on one side of the body, sudden speech difficulty, or facial drooping, seek emergency care immediately. These could be signs of a stroke. For the progressive, less dramatic signs described here, an urgent appointment with a primary care provider or neurologist is appropriate to start evaluation and planning. A short recap. Don't overlook these 8 early warning signs after age 60. Problems planning or organizing, increased confusion at night, trouble finding words, difficulty following conversations, visual spatial problems, subtle gait and balance changes, the most missed sign, sudden emotional changes, a new urinary urgency without infection. Look for patterns, document details, bring those notes to a clinician, and ask about appropriate cognitive and vascular evaluations. Early recognition can open doors to interventions and supports that can make everyday life safer and more manageable. If this helped you, and you think someone you care for should be checked, share this video with them or a family member. For more evidence-based information for people over 60 and their families, like and subscribe. And if you've noticed any of these signs, please consider making an appointment to get things evaluated. Documenting what you've seen will be one of the most useful things you can bring to that conversation.